I'm attorney Presley Henningsen with RSH Legal. While Iowa nursing home residents have the right to freedom to move freely in the nursing home, sometimes extra precautions need to be taken. Often, residents have underlying health issues that make wandering more likely. There are a variety of reasons that your loved one may wander. One of the most common reasons is dementia or Alzheimer's. Residents suffering from either of these conditions may be confused by their surroundings. When they wander, they may be looking for a more familiar place. Another reason that residents wander is because they need something and a staff member is not around to assist them. They may be hungry, thirsty, or trying to find a bathroom. This can happen more often if a facility is not adequately staffed to meet the needs of each one of their residents. If they're not properly supervised, residents can even wander outside the facility, and when this happens, it's known as elopement. Elopement is an especially serious problem, not only because of the high potential for falls and other injuries, but also because a resident can become easily lost. So how can nursing homes guard against wandering? There are a variety of ways that facilities can guard against wandering. Here are a few of the ways that the nursing home can work to avoid wandering or even elopement. 1, they need to evaluate your loved one for wandering tendencies. The first step is for staff to identify how likely is it that your loved one will wander. Make sure you work with the nursing home staff to answer any questions they have about your loved one's risk of roaming. Do not discount the fact that your loved one may not be able to move easily. Even patients in wheelchairs have been known to wander and suffer severe injuries from that. 2, find out the plan of action for a missing resident. It's important for any nursing home to have a plan of action if a resident turns up missing. Ask the nursing home's administrator, what is the facility's response to a lost patient? Make sure they're giving you specific details on how they handle this problem. If they do not, that should be a red flag for you, especially if your loved one is prone to wandering. 3, you may consider using tracking devices or alarms. Many facilities nowadays use tracking devices on their residents to know where they are at all times. These devices can be easily clipped to clothing or worn as bracelets. If your loved one's facility does not make use of these devices, make sure that they have alarms or other warning systems that are being used. And 4, having adequate staff. As we discussed earlier, wandering often happens when a resident needs something. If there's not enough staff to assist each resident with what they need, wandering may happen more often. Make sure your loved one's nursing home employs more than enough staff to accommodate each resident completely and fully. Nursing homes have an obligation to protect the safety of their residents. If they are negligent in this protection, they can and should be held accountable. An experienced Iowa nursing home abuse lawyer can help your loved one get the compensation for their injuries. If you have questions about whether your loved one's nursing home is negligent, if they've caused injuries that were suffered during wandering to your loved one, call RSH Legal today at 1-800-433-0283. RSH Legal, fighting for fairness.